One of the most common questions patients ask during a scan is, can ultrasound detect ovarian cyst? The simple answer is yes. Ultrasound is actually the first and best imaging test used to detect the presence of ovarian cyst. Many women hear the words ovarian cyst and they immediately feel scared. But the truth is, ovarian cysts are actually very common and some of them are harmless. Hi, my name is Chinaza. I am a medical sonographer, and on this space, it is everything ultrasound. Today, we are going to talk about what ultrasound can see in a cyst, what it tells us, and when a cyst can be a cause for concern. During a pelvic ultrasound scan, the sonographer examines the ovaries, the uterus, and surrounding pelvic structures. And if a cyst is present, ultrasound can detect it. It can show the exact location of the cyst, whether in the right or left ovary, the size of the cyst, whether it's a simple cyst or a complex cyst, whether it contains fluid, solid tissues, or both. Because ultrasound makes use of sound waves, it can show fluid-filled structures very clearly, which makes it excellent for identifying cysts. Finding the cyst is only the first step. Ultrasound also helps the doctors understand what type of cyst it might be. There are different types of cysts, from simple cyst to complex cyst. Let's look at them one after the other. The first one is the simple cyst. These are thin-walled cysts. They are filled with clear fluid. Basically, a cyst is a fluid-filled mass. It is a mass that is contained with fluid. And a simple cyst, this fluid is a clear fluid. On ultrasound, the fluid appears black. Sonographically, we call that appearance an anechoic appearance. They are the most common types of cyst and usually form during the normal menstrual cycle. Another form of simple cyst is the corpus luteum cyst that forms during the first trimester of pregnancy. Most simple cysts disappear on their own, whether or not you do anything about it, even without treatment. Another type of cyst is the hemorrhagic cyst. This cyst occurs when bleeding happens inside a cyst. On ultrasound, the fluid inside the cyst may look slightly thick or contain patterns within the fluid rather than appearing completely clear like simple cyst. Sonographically, we call what I just described internal echoes. They can sometimes cause pelvic pain, but the interesting thing is they may also resolve on their own over time. Another type of cyst is what we call the dermoid cyst. Dermoid cysts are benign ovarian tumors. They may contain tissues like fat, hair, or other materials. On ultrasound, they may show echogenic areas, that is, they may show bright areas, or sometimes they may show shadows inside the cyst, which makes them look different from simple cysts. They often require medical monitoring and sometimes surgery. Another type of cyst is what we call endometriomas. These are cysts that are associated with endometriosis. Endometriosis is a different condition on its own, associated with the uterus. Perhaps I'll do a more detailed video on it. And on ultrasound, the fluid inside them looks thick and more uniform. Sometimes they are described as having a dense appearance. We call them chocolate cysts because of their appearance. When any of these cysts are detected, ultrasound also look at other important features such as the thickness of the cyst wall, the size of the cyst, the location of the cyst, whether there are thin lines dividing the cyst on the inside, whether there are solid parts within the cyst, whether there is extra fluid around the ovary, and blood supply around the ovaries. These features help the doctors decide whether the cyst appears harmless or whether they need closer evaluation or medical intervention. The medical intervention for a cyst in some cases for complex cysts that requires medical intervention is surgery and sometimes drainage. Like I mentioned earlier, a cyst is basically a fluid-filled structure, and if the cyst is very large, they could either be removed surgically or they could be drained. The fluid in them can be drained. Your doctor will determine best what treatment will best serve you if ever you come up with a cyst. When should you worry about an ovarian cyst? Most ovarian cysts are benign and temporary. However, doctors may recommend further evaluation if the cyst is very large, usually if the cyst is above 5 cm. Anything less than 5 cm may just need to be monitored. If the cyst contains solid areas, that means, like I explained earlier, a cyst is a fluid-filled structure. So if the cyst begin to contain solid masses or solid areas, your doctor may need to look at it further. They may also need to look at it further if it has internal divisions, if it persists for a long time, or if it causes severe pain that is constant. Symptoms that may lead to an ultrasound scan are persistent pelvic pain, bloating, pain during intercourse, irregular menstrual cycle, sudden severe lower abdominal pain. These symptoms do not always mean that a cyst is present, but ultrasound will help determine whether that might be the cause of the symptoms. In conclusion, ultrasound can detect ovarian cysts and provide important information about their size, their appearance, their location, their type, whether they are simple or complex. And the reassuring news is that most of these ovarian cysts, like I said, are harmless and resolve on their own over time. But if the symptoms persist, ultrasound helps to ensure that nothing serious is missed. In subsequent videos, I'll be explaining more about uterine fibroids. Uterine fibroids, unlike ovarian cysts that are fluid-filled, uterine fibroids are solid masses. And in my next video, I'll be explaining more about uterine fibroids. If you have any question or experience you would like to share, feel free to drop it in the comment section. If you found this video helpful, don't forget to like, share, and subscribe, and I'll see you in my next video.